Hello friends, today we are going to study about the mammary gland, which is also known as breast. It is a modified sweat gland. Its situation: breast lies in the superficial fascia of the pectoral region. It is divided into four quadrants: upper medial, upper lateral, lower medial and lower lateral. A small extension of the upper lateral quadrant, called the axillary tail of Spence, passes through an opening in the deep fascia and lies in the axilla, and the opening is also known as foramen of Langer. Now let us talk about its extension. So the mammary gland is extended vertically from the second rib to sixth rib and horizontally from the lateral border of sternum to mid-axillary line. Now let us see this figure of the extent of the breast. So the breast is divided into the four quadrants, that is upper lateral, upper medial, lower lateral and lower medial. And from the upper lateral quadrant, a small extension called the axillary tail of Spence arises and it passes through an opening in the deep fascia and lies in the axilla, and this opening is called foramen of Langer. So now the breast is extended from the second rib to the sixth rib vertically and from the lateral border of sternum to the mid-axillary line horizontally. So this one is the posterior fold of axilla and this one is the anterior fold of axilla. This one is the sternal angle. Now let's come back to its deep relations. So breast lies on the deep fascia, also known as pectoral fascia, covering the pectoralis major muscle. Deeper to it there are three muscles: pectoralis major, serratus anterior and external oblique, which is the muscle of the abdomen. Breast is separated from the pectoral fascia by loose areolar tissue, also known as retromammary space. Due to this loose tissue, the normal breast can be moved freely over the pectoralis major muscle. Now let's see this figure. So the breast is divided into the four quadrants as upper medial, upper lateral, lower medial and lower lateral quadrants, and a small extension arises from the upper lateral quadrant, also known as axillary tail of Spence. Since the breast lies on the deep fascia, also known as pectoral fascia, and deeper to it there lies three muscles, which are pectoralis major, serratus anterior and external oblique muscle. External oblique muscle is also the muscle of the abdomen. And here is areola with nipple. This one is sternum. And here is the deltoid muscle. And here is cephalic vein. And here is fat. Now let's see about the structure of the breast. So to study conveniently, the breast is divided into three parts, that is skin, parenchyma and stroma. Now let us see about the skin. Skin covers the mammary gland. A conical projection called the nipple is present just below the center of the breast at the level of the fourth intercostal space, 10 cm from the midline. So the nipple is pierced by 15 to 20 lactiferous ducts, and a nipple contains circular and longitudinal smooth muscle fibers which can make the nipple stiff or flatten it respectively. Nipple has a few modified sweat and sebaceous glands, and it is also rich in nerve supply. Skin surrounding the base of the nipple is pigmented and forms a circular area called the areola. Now let's see about the areola. It is rich in modified sebaceous gland at its outer margin. These glands become enlarged during pregnancy and lactation to form raised tubercles of Montgomery. The oily secretions of these glands lubricate the nipple and areola and prevent them from cracking during lactation. Areola also contains some sweat glands and Accessory mammary glands. The skin of the areola and nipple is devoid of hair and there is no fat subjacent to it. Below the areola lie lactiferous sinus where stored milk is seen. Now let us see about the parenchyma, a compound tubuloalveolar gland which secretes milk. The gland consists of 15 to 20 lobes. Each lobe is a cluster of alveoli and is drained by a lactiferous duct. The lactiferous ducts converge towards the nipple and open on it. Near the termination, each duct has a dilation called a lactiferous sinus. The alveolar epithelium is cuboidal in resting phase and columnar during lactation. The smaller ducts are lined by columnar epithelium and the larger ducts are lined by two or more layers of cells and terminal part of lactiferous ducts by stratified squamous keratinized epithelium. Now let's see about the stroma. Stroma forms the supporting framework of the gland. It is partly fibrous and partly fatty. The fibrous stroma forms septa known as the suspensory ligament of Cooper. The suspensory ligament of Cooper anchors the skin and gland to the pectoral fascia. The fatty stroma forms the main bulk of the gland. Fatty stroma is distributed all over the breast except beneath the areola and nipple. Now let's see this figure. So this one is pectoralis major muscle and the breast is separated from the pectoralis major muscle by pectoral fascia and it is separated from the pectoral fascia by a loose areolar tissue called the retromammary space. Due to this loose tissue, the normal breast can be moved freely over the pectoralis major muscle. And this one is the nipple, which is pierced by 15 to 20 lactiferous ducts. And the parenchyma, which is a compound tubulo-alveolar duct which secretes milk, consists of 15 to 20 lobes. Each lobe is a cluster of alveoli or acini and is drained by a lactiferous duct. The lactiferous ducts converge towards the nipple and open on it. Near its termination, each duct has a dilation called as lactiferous sinus. And the stroma, which is partly fibrous and partly fatty, so the fibrous stroma forms septa known as the suspensory ligament of Cooper, which anchors the skin and gland to the pectoral fascia. And the fatty stroma is distributed all over the breast except beneath the areola and nipple. Let's see about the blood supply of the mammary gland. So it is extremely vascular and supplied by the branches of following arteries. Number one is internal thoracic artery, which is the branch of subclavian artery through its perforating branches, and lateral thoracic, superior thoracic, and acromiothoracic or thoracoacromial are the branches of axillary artery. Number third, lateral branches of posterior intercostal arteries. The arteries converge on the breast and are distributed from the anterior surface, and the posterior surface is avascular. Now the veins. This follows the arteries. They first converge towards the base of the nipple where they form an anastomotic venous circle from where veins run in superficial and deep sets. The superficial veins drain into the internal thoracic vein and into the superficial veins of the lower part of the neck, and the deep veins drain into the axillary and posterior intercostal veins. Now let us see about the nerve supply. So the breast is supplied by the anterior and lateral cutaneous branches of the 4th to 6th intercostal nerves. And the nerves convey sensory fibers to the skin and autonomic fibers to the smooth muscle and to the blood vessels. Nerves do not control the secretion of the milk. The secretion is controlled by the hormone, which is known as prolactin, which is secreted by the pars anterior of the hypophysis cerebri, also known as pituitary gland. Now let's see the arterial supply of the breast. So the breast is supplied by the internal thoracic artery, which is the branch of the subclavian artery through its perforating branches, and from the lateral thoracic artery, superior thoracic artery, and acromiothoracic artery, which are the branches of the axillary artery. And third, from the lateral branches of posterior intercostal artery.